just in 1 minute after that. Thank you.
Want me to count down from 5, 4, 3, 2, 1. Good evening. I'm Congresswoman Alma Adams, and it is my pleasure to welcome everyone to our virtual reception. I wish we could be together in person, but this is our new reality. But first of all, let me thank my co-chair, Representative Underwood, and Senator Booker, who wasn't able to join us tonight. But I'm so proud that we get to be soldiers together in this fight. I also want to thank all of my colleagues who've joined us tonight, both from the House and the Senate, by leading individual bills in the Momnibus, and for joining the Black Maternal Health Caucus. We thank you so very much. And so when we launched this caucus almost 2 years ago, we had no idea that we would garner such incredible support, more than 100 members on both sides of the aisle, and we plan to add many more. But today we unveiled the Black Maternal Health Momnibus Act of 2021, a comprehensive 12-bill package that tackles one of the greatest public health crises of our time. And with the support of a historic coalition of nearly 200 healthcare providers, Black mothers, policymakers, researchers, activists, and maternal health advocates, we've crafted a collaborative, targeted, and timely set of policies that will improve maternal health outcomes for Black pregnant and postpartum individuals, particularly during this COVID pandemic. Many of you here tuning into this virtual reception are the reason we have this incredible bill. So thank you, thank you. Thank you for your years and years of advocacy, your passion, your commitment to making giving birth safer for Black mothers. In Congress, this journey to the Momnibus began back in 2018, when then Senator Kamala Harris, now our Vice President, and I worked with the Black Mamas Matter Alliance to introduce a resolution honoring the first Black Maternal Health Week and a bill called the Maternal Care Act. But for me personally, this work began when my daughter Janelle almost became a victim of this crisis. A physician overlooking my daughter's complaints of pain in her abdomen, not listening to her needs as a Black woman, not trusting that she knew her own body. Their dismissal of her pain almost cost my daughter her life and the life of my granddaughter Jocelyn, who is now 15. Over the past 2 years, since the launch of the Black Maternal Health Caucus, Congresswoman Underwood and I have talked about how these terrible inequities in our society and in our healthcare systems have stolen countless moms from their children. So when we think about how important mothers and grandmothers are to their communities, we should recognize that moms touch so many lives, even outside their immediate family. My daughter is not only the mommy to my two amazing grandchildren, but she's the principal to all of the students at Reedy Fork Elementary School. I also have two other wonderful grandchildren, and the thought of losing any one of them is truly heartbreaking. So, as you can imagine, this issue is deeply personal for me and to so many others. Sadly, not only have we been battling a Black maternal health crisis now over the last 11 months, we've been fighting the public health emergency of the COVID-19 pandemic. And as I've said from the start of the pandemic, this is a crisis within a crisis. We know that Black and brown babies have borne the brunt of the pandemic, and the health disparities that existed before COVID-19 have been further exacerbated. And since the beginning of COVID-19 pandemic, over 64,000 women that we know of have contracted the virus while pregnant, and those are the ones we know of. Now, according to two CDC morbidity and mortality weekly reports, we learned that pregnant women might be at an increased risk for severe illness from COVID-19 and the potential risk for preterm birth. Further, Hispanic or Black women were found to be disproportionately impacted during one of the most joyous times of their lives. And that's why this year, our package specifically addresses this crisis within a crisis with new bills. These new bills make targeted investments to advance safe and respectful maternity care and improve data collection, surveillance, and research on maternal health outcomes during the pandemic and beyond. We invest in environmental justice because recent studies have reinforced the linkage between man-made climate change and the toll that it takes on pregnant women and their infants. And while we provide funding for programs to increase maternal vaccination rates, protecting moms and babies. And finally, let me take a moment to speak about the bill that I'm honored to lead in the package, the Kira Johnson Act. When I introduced her bill for the first time last year, I told you her story. In 2016, Kira Johnson checked into a hospital with her husband to give birth to their second son, Langston. Kira, an entrepreneur, world traveler, mother of one healthy boy already, and a Black woman, she did not make it out of that hospital alive. She died from hours of neglect and severe hemorrhaging nearly 12 hours after delivering Langston. Kira deserved better. Kira Johnson mattered. And we know that it didn't have to be this way. For Kira, for all of the mamas who we've lost to this crisis or who have almost we've lost due to errors and bias in care, we have to pass the Momnibus and the Kira Johnson Act. That's why her bill is focused on providing funding to community-based organizations that are working to improve maternal health outcomes for Black women. It also supports the implementation of bias and anti-racism training programs and the establishment of respectful maternity care compliance offices within health systems. It is all about accountability. It is clearer than ever that we have a lot of work to do, but we will not stop shining a bright light on the racial health disparities and the unacceptable outcomes that Black women continue to experience here in this great country. For decades, the US maternal mortality and morbidity rates have gotten worse for all mothers, but especially for Black women, whose health outcomes are further compounded by systemic and structural racism. But all hope is not lost. We are not hopeless. This year's Momnibus ensures our healthcare systems, our providers, and society will truly make Black maternal and infant health a priority. I look forward to working with my colleagues and all of you to get this Momnibus passed into law. And we're going to get this done for Black moms because our moms cannot wait. And I'm going to turn this back over now to not only my colleague, but my partner in this struggle, Congresswoman Lauren Underwood.
Well, thank you, Congresswoman Adams, and good evening, everybody. I am so honored to be able to co-lead the Black Maternal Health Caucus with Congresswoman Adams and all of our work together on the Momnibus. Thank you for your friendship. To everyone tuning in for tonight's celebration of the introduction of the Black Maternal Health Momnibus Act of 2021, welcome, and thank you for being here. I am so excited to be with you and to be joined by my colleagues who have championed this legislation and this cause. Now we're ready to get to work to pass the Momnibus, save lives and disparities, and promote true equity and justice in maternal health outcomes in the United States. Today represents a significant step forward in that urgent mission, and it's a step that would not be possible without the organizations and communities across the country who have partnered with the Black Maternal Health Caucus to develop this legislation and advance it in Congress. Now, there are far too many groups to name, but I'm excited that you'll be hearing from some of them later this evening. Before that, you'll hear from members of the Black Maternal Health Caucus who've helped introduce the Momnibus. Included within the Momnibus are 12 different bills, all led by members of our caucus, addressing from topics ranging from social determinants of health to the impacts of COVID-19 during pregnancy to maternal mental and behavioral health conditions. You'll hear about those bills in our conversations, and you'll probably hear the statistics that you've come to know all too well. The maternal mortality rate in the United States, which is the highest in the developed world. the disparities facing Black women and other birthing people of color, and the unacceptable lack of progress on this issue. But for many of you who might be watching, this crisis is not composed of statistics and research alone. It's a story that you may have lived, whether it's a near-miss experience for yourself or pregnancy-related death of a loved one. For many of you, and for me, it's personal. Last year, we gathered in person to announce the first ever Momnibus, and I told the story of my friend, Shalon. Many of you are now familiar with her story. Dr. Shalon Irving was a classmate of mine in graduate school who went on to become a dual PhD, a CDC epidemiologist, a lieutenant commander in the US Public Health Service Commission Corps. Yet no college degree, no salary raise, or level of family support protected Shalon after she gave birth to her beautiful daughter, Soleil. And 3 weeks later, Shalon died. Shalon's memory inspires me in this work, just as Kira's memory inspires my friend, Charles Johnson. Just like so many of you who've dedicated yourselves to this mission because you know what it's like to lose someone. Tonight, the memories of all those people carry us forward to do this work. And we don't do it alone. So many champions who have joined us virtually this evening have committed themselves to this cause, whether as members of Congress, leaders of maternal health organizations, and other Black Maternal Health Caucus partners, and people all across the country who have called their representatives to talk about why this issue matters so much to them. I am grateful for all of you. And I'd especially like to take a moment to thank my friend, Senator Cory Booker, who is the lead sponsor of the Momnibus this year. As you know, the Momnibus was led by then Senator, now Vice President Kamala Harris in the Senate last year. I can't imagine a better person than Senator Booker to take up the torch and carry this work forward in the Senate. And here in the House, well, we are joined by so many colleagues who've dedicated themselves to this mission, many of them joining us for last year's Momnibus bill. So although I'm excited to be with them again this year, I hope this is our last Momnibus introduction event, because in the 117th Congress, we are going to pass the Momnibus and we will get it signed into law. At this time, I am so excited to join my colleagues in conversation about this issue, our legislation, and the path forward for the Momnibus. So I would first like to introduce my friend, Congresswoman Gwen Moore from Wisconsin's 4th Congressional District. Now, Congresswoman Moore has been a leader on maternal health for many years, and I am so honored that she's the lead sponsor of the Perinatal Workforce Act in the Momnibus for the last 2 Congresses. Congresswoman Moore, do we have you?
I am here. So happy to be here with you. And Representative Alma Adams, just let me say, this was a very heavy lift to try to make an intervention in the maternal deaths of Black women. I mean, there are so many so-called third world countries who do better with maternal health than we do in the wealthiest country in the world that spends the most money on healthcare. And it's a heavy lift, but you were able to bring together these 12 bills to make it the Momnibus to address systemic institutional problems with producing healthy births and sparing the lives of mothers. My experience, my interest in this legislation and my legislation, the Perinatal Workforce Act, really has been inspired by my own lived experience. Yeah. I became a mom at age 18, gave birth New Year's Day, and was terrified in the hospital as every resident intern shoved their arm up and gave me an exam. So traumatized was I that I gave birth the next 2 times with the help of maternal, with doulas, with the midwife, with midwives at home. And I learned from that experience, but also my very first granddaughter was 1 pound, 2 ounces. And so that really put me into motion about making all the appropriate interventions, making sure they were lactating coaches. I mean, we needed, a 1 pound, 2 ounce baby. You can't give, you need mother's milk.
Okay.
And so my own lived experience taught me the thing that was similar with all my experience with giving birth to my child, having that public health nurse come to my home for the first time when I had no idea what to do with a brand new baby. That we needed to focus on a perinatal workforce.
Yes.
With physician assistants saved my daughter's life when the doctor was about to come in and do another C-section, and she went through the chart and noticed that the incision had been made, and she pointed it out and intervened in what could have been a catastrophe. So whether it's a doula that's going to make sure that you make those appointments and that you're eating something besides, delicious, hot stuffs and soda, or people to help just coach. And what I needed at 18 desperately was an advocate.
Yeah.
And so I am so proud to be joining this effort. Thank you again. We've got a nurse and a professor of women. And so what better combination to bring us all together with this mom.
And we'll get it done. Thank you so much for being with us tonight and for your incredible leadership. It's so good to see you. Thank you. And now I'd like to introduce our good friend, Congresswoman Terry Sewell, who represents Alabama's 7th Congressional District. Now, in addition to her ongoing leadership on Medicaid expansion, Congresswoman Sewell has been one of our lead sponsors of the Momnibus for the past 2 years. And this year, she also introduced the Maternal Vaccination Act. Congresswoman Sewell, can you talk a little bit about the bill you're leading and your broader motivation to champion this issue to address the Black maternal health crisis?
Well, first, let me just say what a pleasure it is to join you and Congresswoman Adams in reintroducing this omnibus package of bills. As you stated, I am leading the effort for the Maternal Vaccination Act, which would encourage folks to actually get vaccinations as a part of their prenatal care. I think it's really important for me as a member of the caucus, the Maternal Mortality Caucus, to also champion the needs of rural and underserved communities that I represent. So often, we all know that statistic that Black women are 3 times more likely to die in childbirth than white women. And these disparities in this great country of ours are simply unacceptable. When I think about Alabama being the 7th lowest rate of childbirth and an increased amount of the incidences of death occurring, irrespective of economic level, it is really appalling. I know for me, I was really proud as a member of the House Ways and Means Committee that we had a full committee hearing on Black maternal mortality. And we had testimonies from Olympiad Allison Felix, who actually told of her experience, which was really devastating. And I know that so many in my district don't receive the flu shot when they're pregnant. The vaccination rates are really low. And so one of the things that we would do in the Maternal Vaccination Act is that we would also promote outreach to mommies about their health while they're pregnant, as well as their baby's health and why vaccinations are so important. You know, being the representative from Alabama, we all know that there are legitimate concerns in the Black community about Black exploitation of our bodies caused by the federal government, the Tuskegee experiment. So I think it's really important that the Momnibus also talks about the disparity that exists in vaccinations. My bill would do just that. And I want to encourage all of us to work as hard as we can to get this passed. I, like you, are really encouraged by the fact that our Vice President of the United States used to be a lead sponsor in the Senate of the Momnibus, and look forward to its passage, and a part of its passage dealing with the real concerns of vaccinations and the gap that exists in vaccinations. I also think about my rural community, many of which have had, because of cuts in costs, done away with their OBGYN units, which means that access is a real issue. I have several rural hospitals that close their OBGYN unit. And so people have to travel 2 hours just to have a baby. This just exacerbates the already chronic problems that exist between white and Black mommies when it comes to childbirth. So again, I want to thank you for your leadership, and I want to really give a shout out to all of my fellow members of Congress that are part of today's introduction, who have wonderful bills that are a part of the Momnibus. Thanks again, Lauren, for your leadership. And I look forward to being upward and onward and making sure that we pass the Momnibus and get it signed into law so that we can help mommies and babies and families.
Thank you, Congresswoman Sewell, for your incredible leadership and your fierce advocacy on behalf of the great people in Alabama. Thank you for all that you do and for joining us tonight. I'd now like to welcome my friend and classmate, Angie Craig, who represents Minnesota's 2nd Congressional District. Now, Congresswoman Craig and I often team up on healthcare issues. We are like, we will double team folks. We are very fierce advocates, and I can't think of a better partner on these issues than to have in Angie Craig. So I am so grateful for her leadership on the Momnibus. Congresswoman, what motivated you to become a champion on these issues related to Black maternal health and join us here in the caucus?
Thank you so much, Lauren. And I was going to say exactly the same thing. When leadership sees Lauren and I coming, they know it's likely about healthcare, and we make sure that the caucus never ever forgets, not that we could during COVID-19, that healthcare is the #1 issue in our country. Congresswoman Adams, thank you for your leadership. And honestly, Lauren, you never want to follow Gwen Moore and Terry Sewell. So I don't know who made up the order today, but thank you for that. I'm so excited to continue working with the Black Maternal Health Caucus in the 117th Congress. My motivation is simple. We have to root out health disparities impacting people of color in this country, and in this instance, Black women in particular, and make sure that our healthcare system is more equitable for all Americans. We've seen COVID-19 really put a spotlight on the disparities in healthcare that exist, the inequities. And of course, as a member of Congress representing the state of Minnesota, where George Floyd was murdered, it's particularly important to me that we raise up healthcare inequities is a major focus of systemic racism in our country, and we help to root that out. For far too long, we have failed to address the rates of maternal mortality for Black women and birthing for people of color who are dying, as you all know, at 3 and 4 times the rate of their white counterparts. It's unacceptable in America that this continues to happen. And so that's why I'm supportive, Lauren, of this comprehensive approach that the Black Maternal Health Momnibus Act takes to addressing these long-term, long-standing health crises and issues. So, I'm just so excited to be here. I'm excited for the work that we're doing around telehealth to make sure that both people of color as well as folks in rural areas have better access to healthcare. And I'm so honored to work with my colleagues in the 117th Congress on these important issues.
Well, Congresswoman Craig, you are a gem. Thank you for joining us tonight and for your great leadership as part of the caucus and on the Momnibus. It really means a lot. Thank you for all that you do.
Thank you.
I'd now like to welcome our friend, Darren Soto. Now, Congressman Soto represents Florida's 9th Congressional District. He is a member of our Black Maternal Health Caucus. He is the first gentleman to join us this evening, and he was there to help us introduce the Momnibus last year. So welcome. Can you describe your work on this issue, Congressman, and why you wanted to get involved as a leader in the Black Maternal Health Caucus?
Well, thank you, Congresswoman Underwood, and thank you for your leadership and for the leadership of all the strong women on this call. I joined the Black Maternal Health Caucus and helped co-introduce because this is an important issue for my Central Florida community, and it's an important issue for America. Behind me is Amaya Brannon. Those of you who watched the Super Bowl last night may have seen she won the NFL Super 60 contest, which requires athletics and exercise commitments. And she's from East Polk County, from Auburndale in my district. East Polk County has many historically significant African-American communities that were founded around Reconstruction. So a lot of history there. It's where Alcee Hastings comes from. John Lewis remembered, he imparted to me going down there to pick oranges with his dad. And we've had Whip Clyburn and Congressman Richmond and Sheila Jackson Lee also join us there. And it's a topic of conversation quite a bit in the district, and particularly in those important cities, with the birth mortality rate continuing to be a real challenge, where we see it being a disgrace that African-American women and Native American women have mortality rates 10 times as much as Anglo women, and to a certain extent, Hispanic and Asian women are also seeing 3 to 5 times the amount. We saw that testimony in the Energy and Commerce Committee. We saw, obviously, my colleague, Congresswoman Craig, who is on that committee, along with Congresswoman Kelly, who's been a huge leader on these issues. Just as recent as 2 weeks ago, we were talking about this at a Dr. Martin Luther King Jr. event recognizing Dr. King's legacy. We had Dr. Pass, a strong African-American doctor who's the head physician at Advent Health in Lake Wales, talk just on this subject in particular, and about how important it is to have more African-American and Hispanic doctors, and how we need to do more outreach so that we have trust in communities that were discriminated against in the past. And so that's why expanding the Medicaid wraparound services both before and after birth are so critical. I know those are areas we worked on together and will continue to work on. That outreach, the robust, diverse scientific studies we saw in COVID that reminded us how critical it is to have diverse studies as we're bringing new medicines online. So in order to make sure the next generation of African-American children, Hispanic children, and other communities of color can grow up just like Amaya Brain, and I'm here today to join you, and I appreciate your leadership on this important topic.
Well, thank you for joining us. You know, Congressman Soto is also the chair of our group called the Future Forum, which represents young Americans and so many birthing people across the country. And so I am just tickled to have you on with us at tonight's reception. And thank you for all of your work to advance the Momnibus. We really appreciate it. Thank you for being with us, Darren.
Thanks for having me, Lauren.
Thank you. Okay, so I'd now like to welcome Congresswoman Marilyn Strickland. Now, Congresswoman Strickland represents the 10th Congressional District in Washington State, but she is a history-making, groundbreaking freshman Congresswoman, okay? She is the first African-American to represent Washington State at the federal level. She's also the first Korean-American woman elected to Congress in history. Yes, Congresswoman Strickland is about a month into her first term. She is already here as a leader in the Momnibus, and I am just so delighted to be able to welcome you to our conversation tonight. So what inspired you to get involved in this issue?
Well, thank you very much for that warm introduction. And thank you, Congresswoman Underwood and Congresswoman Alva Adams, for your leadership on this. What inspired me to get involved in this is really the fact that there are so many intersections with the work that we're doing. We are talking about high mortality rates when it comes to Black women who give birth. But we also know that there are social determinants that sometimes have an impact on that. And that's everything from housing to transportation to food deserts. And we have to do the things that we know that affect the entire ecosystem to address this issue. What I appreciate about the work that you're doing, though, is that you talk about growing and diversifying the perinatal workforce. And so much of this often comes down to the fact that people get treated differently in healthcare systems. As Black women, people view us as strong. And sometimes that means they think we can endure pain and things differently than other people. As a woman who is half Asian, I know that people think that Asian women suffer in silence. And those are just two examples of cultural cues that can affect the type of treatment you get when you go to a hospital to need care. And of course, for me, this is about strong communities. We want women to give birth and to be treated well during pregnancy and to get access to the resources that they need. And we want to make sure that we are resourcing community health care clinics and health departments and the entire ecosystem that we know can really help during a woman's pregnancy. So as I think about what this means to me, I'm here to make my community better. I'm here to stand up for Black women and Black communities. I am here as a woman of color representing the AAPI community, and I know that this legislation is going to do a better job of collecting data, of holding us accountable, and acknowledging some of the disparities that exist in the healthcare system. It's good for our entire community, and I'm honored to be here with all of you today. And please consider me a partner and a champion in this work.
Yes, I love it. Well, I am so thrilled to be able to work with you to help save moms' lives. And thank you for your incredible voice in the Congress. So delighted to be able to work together here. Thank you for joining us tonight. I'd now like to bring in Congresswoman, my friend, Congresswoman Mary Gay Scanlon, who represents Pennsylvania's 5th Congressional District. Now, Congresswoman Scanlon has worked tirelessly to address the maternal and infant health disparities in Pennsylvania and across the country. And she's been a leader on the Momnibus in 2020. And here we are in 2021, and Mary Gay came back. Thank you. So Congresswoman Scanlon, can you talk about your work as a leader on the Black Maternal Health Caucus and why this issue is so important to you?
Sure. So, well, thank you, first of all. Thank you, Lauren, for leading, and Representative Adams. I think your leadership on this issue just shows what it means when we diversify Congress, because we get a different focus on different issues. And that's very much how I came to the issue. My career is in civil rights, and I've been working in the legal aid sector with an emphasis on child advocacy over the years. So children's health was always a big part of what I was doing. But in 2018, when I ran for the first time, I was part of a group of women who were running when Pennsylvania was the largest congressional delegation in the country with no men. No women, 18 men, no women in our congressional delegation. And we would go to these forums and people would say, well, what do you think about reproductive health care? And they always talked about abortion. It's like, well, wait a minute, that's not reproductive health care. There's so much more to it. And at the time, there were all these studies coming out about maternal mortality. And it's not just Black women, all women in the US have a much worse rate of mortality than the rest of the developed world. The US lags far behind, and we're getting worse. But then when you drill down and you look at the results for Black women, Native American women, Hispanic women, it's even worse. We know everything's intersectional. So what was really infuriating to me, and I tend to run on anger, was the fact that we know how to fix this. The rest of the world has implemented measures which are beautifully outlined in the multitude of bills that are part of the Momnibus. We know how to fix this. You have more doulas, you have midwives, you address the social determinants. So of course we have to fix this. We have to do this. So that's why I was so grateful when Lauren and Representative Adams and Vice President Harris took the lead to introduce this package of bills to address this really critical issue that just was wanting attention. So I'm really grateful for the opportunity to support the good work, to be all in. It's really, really important in my district. I gave birth in the oldest hospital in the country, Pennsylvania Hospital, right here in Philadelphia. But we know that across the rest of the district, the access to prenatal, postpartum care, it just doesn't stack up. So thrilled to have the opportunity to work on something that's going to make such a concrete difference for our communities. So thank you.
Well, thank you. And what you said is spot on. There are solutions. This is not a problem without a solution. And so to be able to embrace and lift up these solutions that will save lives makes a big difference. Thank you for your leadership and for being with us tonight. I'm so grateful to be able to do this work with you, Mary Gay. Thank you. I'd like to welcome Congresswoman Lisa Blunt Rochester. So Congresswoman Lisa Blunt Rochester represents the whole state of Delaware, which is pretty incredible. And she's been one of our lead sponsors of the Momnibus for the past 2 years. And this year, she introduced the bipartisan Moms Matter Act with Congressman John Katko. So Congresswoman, can you describe your bill and why we need to pass it, as well as your other work on this issue?
Well, first of all, Lauren, I have to say, like everyone else on this Zoom, how thankful I am that you and Alma are leading this, how great you are, because not only are you bringing the strong policy chops to this work, but you also have brought the positivity. And to say that what this is about, what the Momnibus is about positive change. And I hadn't thought about it until all of my colleagues talked about why they care about this issue. But that I started as one of the jobs I had early on, almost 30 years ago, was Deputy Secretary of Health and Social Services. And we were talking about those issues and trying to shine a light on them for decades. And we know that this pandemic has shined the light in a way that we've never seen before. But to my incredible colleagues who are on this Zoom, I see you. I'm so excited to be working with you again. And I just want to say that I echo the comments that were made before. I'm glad to be a part of the Black Maternal Health Caucus. And I was proud to introduce the Moms Matter Act today as part of the Momnibus package. It's endorsed by 160 organizations, and my bill will make investments in programs to support moms with maternal health, mental health conditions, and substance use disorders. We know it is already stressful enough, and so it is important that we have those investments for moms. And it also provides funding to grow and diversify the maternal, mental, and behavioral health care workforce, which is also important. Like the rest of the Momnibus package, the Moms Matter Act is about really 3 things. This evidence-based programs we know that will work to help reduce disparate health outcomes, to better provide services to those delivering, and ultimately to bring an end to maternal mortalities. And I think so much about our own personal experiences. I know for me as a mom, my son, who is about to be 35, was born in France by a midwife. My daughter, Alyssa, who is 32, was born in the United States by a midwife. But I also think about all those others that did not have those positive experiences. And it didn't matter how much money or how much education they had. You could ask Serena Williams or Beyonce. It still matters how we are treated and how we face this issue. And so I want to thank Representative Katko, my Republican colleague, for joining me as a co-lead, and Senator Gillibrand for the Senate version, as well as Cory Booker for his leadership. And to all of you, my colleagues, our goal is to make maternal mortalities a thing of the past. And I am so glad to be on the battlefield with you. And I thank you so much, Lauren, for your leadership, and Alma. Thank you.
Thank you, Lisa. You know, Lisa's just a ray of sunshine every time, right? She's like this every day. And I am so honored to be able to do this work with you. So Congresswoman Blunt Rochester has one of 2 bills that are currently bipartisan, but we're hoping for more. We're going to keep building the support in the Congress. And I talked to Senator Gillibrand earlier today, and she's pumped. And so I'm feeling the energy, and I'm so grateful for your leadership.
Can I just say one other thing, Lauren, because what you just said, it touched my heart, and it reminded me of Ayana, who reaches out to me and texts and say, "What did you do for self-care today?" We, especially as Black women, we need to be there for each other. And that's why this is so incredible to see Black men, Black women, white men, babies, everybody all on the battlefield together. So thank you for the leadership, and thank you all for our support of each other as we support people in our country. Thank you.
Thank you. We are now joined by our friend and colleague, Congresswoman Debbie Wasserman Schultz. So she's been a health equity champion, particularly for women, for the more than 15 years in Congress as the representative from Florida's 23rd district. Congresswoman, now you've been a leader on so many issues for women and girls, from expanding access to mammograms to preventing and ending domestic violence. What motivated you to focus on maternal mortality and ending these maternal health disparities?
Well, first of all, let me just say that your leadership on this issue and bringing us together and making sure that you can convene advocates and women leaders on this important issue allows us to really exponentially make sure that we have the reach we need to prioritize these issues. So thank you, and especially now that you are an appropriator. So having the appropriator's power. No offense to my non-appropriator friends, but the reach that you will have now as an appropriator is going to really make a difference. And so I am really proud to be on the Black Maternal Health Caucus with all of you, and the reason that it's so critical that we make these issues a priority is because we have critical mass now with women in our midst. I mean, we have not only the largest number of women ever serving, but we have 37 women who are moms of school-aged children serving in Congress right now. And we started the Moms in the House Caucus, and that was another way for us to organize together to be able to make these issues a priority. From the place I serve in appropriations as the chair of the Military Construction and VA Subcommittee, what we've been prioritizing is making sure that women veterans and veterans that are moms are able to have their reproductive and health services prioritized, which has been a real challenge. You would not believe, and I need to sit down with you, Lauren, to go through what we're trying to make sure we can clear up in terms of the inequity of access to reproductive health care at the VA. So I'm so glad to see the provision in your bill, in the package, to study the unique maternal health risks that face pregnant women and postpartum veterans and the healthcare services they need. So that's one of the things that is a way we can micro-target these challenges. Rather than we don't want to just deal with them in the broadest sense, we want to micro target. And so that's how bringing us all together is going to enable us to do that. So, and I agree with you on Lisa's being a ray of sunshine every single day.
Well, thank you, Debbie.
Thank you. You're
I
welcome.
appreciate your leadership. Now, Congresswoman Wasserman Schultz is what we call a cardinal, and her leadership on this MilCon VA subcommittee is so critical. I am honored to lead the Protecting Moms Who Served Act with Congressman Gus Bilirakis. This is one of the bipartisan bills, but we can't get this work done without her leadership on the Appropriations Committee. So thank you for being with us tonight.
I got your back.
Debbie, I'd like to say that Lauren is pretty, she's a ray of sunshine too, and that's clearly because she's an appropriator. You know, she's got a whole affect going on here. You know, she's feeling very, very encouraged. So
exactly.
Yeah.
It's all about the green.
Exactly.
At the end of the day.
Thank you. So now we have a special guest and a very special guest. So I am so pleased to welcome Congressman Seth Moulton with us now. Congressman Moulton and I stood alongside our now Vice President Kamala Harris on the stage last year, almost a year ago in March, to introduce the Momnibus. And although we're gathered virtually this year, Congressman Moulton continues to stand as a leader on this issue. He's the representative for Massachusetts 6th District, and he is a true Black maternal health champion. So thank you for being with us. What's motivated you to do this work?
Well, Lauren, frankly, you have, in part. It's an honor to be here with such a privileged group. And God forbid I ever disagree with my fellow delegation member, Ayanna Pressley, but you were a ray of sunshine just when you were running for Congress. And I was so proud to support you with my group, Serve America, as someone who knows what it means to serve, because you've served your community so well. And, lest I come across as sort of a bad dad or using Emmy here as a prop, the reality is that Emmy is under my care right now and sort of paying attention because my wife Liz is 9 days out from being due. So I am about to actually go on paternal leave myself, and taking a little bit of time off to take care of Emmy more full time, and then help out Liz as we welcome Emmy's younger sister. And the reality is that when I do that, and when Liz and I go into the hospital to give birth to our second daughter, we're going to worry about a lot of things. The pandemic, for example, we don't know exactly how to handle that with a new kid and what exactly the quarantine requirements are. They seem to always be changing. But one thing we won't worry about is literally losing Liz through childbirth. And it's absolutely insane that so many mothers in America, especially Black mothers and their families, have to worry about that right now. Why shouldn't Americans have the absolute best healthcare in the world? And Debbie's right, it's especially a problem with veterans. And as someone who's a veteran and is particularly involved in making sure that veterans get all the care that they need, that's an inequity that must be righted. And I'm so glad to know that provisions for that are included in this bill. So it is truly an honor to be here, and especially at this special time for me and my family, for Emmy in particular. And so thank you so much for allowing me to be a part of this and to offer my humble support for your incredible and truly inspiring work.
Well, thank you, Seth. All my best to Liz and your family. We are going to be praying for a safe and smooth delivery and a wonderful postpartum period. And to Emmy, let me just tell you, from one big sister to another, you've got this, girlfriend. I'm so glad to meet you and can't wait to see you and your new little sister one day soon. Thank you for being with us tonight.
Thank you.
I am now so delighted to bring in my fellow member of the Illinois delegation, Congressman Danny Davis. So Congressman Davis represents the 7th District of Illinois, which is in Chicago, and he has led so many important bills supporting moms and babies throughout his career, including key investments in home visiting. So we heard Congresswoman Moore talk about the power of that home visit that she had in her remarks. And so Congressman Davis is also an original co-sponsor of the Momnibus. Thank you, sir, for being with us tonight. Can you describe why these efforts are so important to you and to your constituents in Chicago and Cook County? And you're muted.
Lauren, let me thank you and Alma Adams, as well as Cory Booker and all of those who've been seriously engaged with the development of this caucus and this legislation. I've been fortunate to have been around for a good period of time. As a matter of fact, all 10 of my brothers and sisters and I were delivered by a midwife. And fortunately, all of us survived and all of us fared okay. And we all did all right.
Yes,
of course, I represent a large number of African Americans. As a matter of fact, Chicago, until recently, had more than 1 million Black people living in Chicago. 1 million. I represent a large number of low-income individuals who live in, around, and are part of public housing. Of course, this year we celebrate the 50th anniversary of federally qualified health centers. I've had the opportunity to work in 2 of them, and at one point served as president of the National Association. And of course, we're very proud of the role that they have played. We're very proud of the role that home visiting has played and continues to play. I also represent an area that have more hospitals in it than any other single congressional district in America. I have 24 hospitals. I have 4 outstanding medical schools. And we always say that health is wealth. I mean, never does a day go by. I want to thank my health staff, and I'm fortunate I have a retired physician who is now serving on my staff for the last this is 2.5 years, and he's a fellow after having worked as a physician in Illinois for more than 25 years. And so I want to thank my health staff for the tremendous work that they have done and continue to do. I think that health awareness, health promotion, health education, all the area where I am sitting right now, at one point had the highest infant mortality rate in Western civilization. I mean, public housing was all around. And it actually speared the development of health resources. And with all the resources that we still have some of the highest mortality, morbidity, and maternal health rates in Western civilization, which means that we ought to be able to do better, means that we can and should be doing better. So everybody that's a part of these tremendous bills, all coming together, being a part of helping make sure that health is indeed a right and not a privilege. I'm just proud to be a part of it. My staff made sure that I could listen to all of the testimonies, if you will, and all of the comments, even though we do a health piece every Monday night at 7 o'clock. We call it Chat with the Doctors, and we actually have about 7 or 8 physicians, African-American physicians mostly, on every Monday night to talk health. Health is wealth. I'm pleased to be a part. Again, I commend you and Alma and Corey, all of the people who've made this a part of their lives and their work, and thank you very much.
Well, thank you, sir, for your leadership. You know, to tell that story of reducing infant mortality in your community shows us that it can be done. With key investments over the years and intentional policy leadership, we can save lives. And so I'm so grateful for the example that you set for all of us, and grateful for your partnership as part of the Black Maternal Health Caucus. Thank you for joining us tonight.
Thank you.
And last but not least, I am so excited to be able to welcome our friend, Congresswoman Ayanna Pressley, who represents Massachusetts' 7th Congressional District. Now, Congresswoman Pressley has been with us as a leader in the Black Maternal Health Caucus for 2 years now. Well, since the Momnibus, so last year and this year, as the sponsor of the Justice, what's it exactly called? The Justice for Incarcerated Moms Act. Yes.
I'm going to talk about it.
Okay, good. So please tell us about your bill and what motivates you in this work. And thank you for being with us tonight.
Absolutely. And I just want to say what an honor it is.
We got you muted. Okay, everybody, I think we're back. And so we were disrupted while we were hearing from Congresswoman Ayanna Pressley about her experiences as a native Chicagoan, which is something that folks may not have known, but we are so proud to claim her. And I'll turn it back over to you.
Thanks, we'll get right into it. And what I was just saying is that it was an honor to follow Representative Davis, because I was raised in Chicago, and Harold Washington was a huge influencer in my life. And certainly Representative Davis, they have always centered the people in all things, and been justice seekers like all of you who are a part of this caucus. And it really is justice that we seek. The Black maternal mortality crisis is a matter of healthcare justice and also racial justice. And the fact that this caucus has been founded by Representatives Underwood and Adams respectively is a testament to their leadership and them being responsive to the surviving family members or those who have survived harrowing experiences that were nearly fatal. And so we thank you for honoring the mandate that the people delivered you to Washington on. We thank you for demonstrating the power of representative government and for honoring the tradition and the legacy of the Congressional Black Caucus as the conscience of the Congress, to be the host of such a pace-setting and groundbreaking task force. So it's my honor to be a member, of this caucus rather. And just how I come to this work really quickly, I never had the honor of meeting or knowing or being loved by my maternal grandmother, Grandma Carrie. She died in childbirth in the 1950s in Cincinnati, giving birth to my father's youngest brother. And that sent my father and his 4 other siblings on a very painful life trajectory. My father actually ended up writing a book about how her death, her abrupt death, left him to live a life without a compass. And so I wanted to just say that's how I come to this work. It's a way for me to honor my grandmother Carrie and the fact that she would have died in childbirth in the 1950s, and that Black women today would still have the same damning statistics is unacceptable. The other reason, how I come to this work, motivating reason, is that I ran for Congress to advocate for the ignored, the left out, and the left behind. And that includes those that are incarcerated. And the fact of the matter is that a safe pregnancy should be a right, not a privilege. Every person should be able to experience their pregnancy without worrying if they will survive delivery or make it to their child's first birthday. And this, unfortunately, has not been the reality for pregnant people of color, especially Black women, who face significantly more pregnancy-related health risks than any other ethnic group. And so that's why I was going to say I'm proud to stand shoulder to shoulder, but I guess I'm proud to sit shoulder to shoulder on this Zoom at this virtual dais with all of my colleagues to reintroduce the Black Maternal Health Momnibus Act of 2021, a comprehensive responsive bill to confront and combat the Black maternal health crisis. And this bill contains a number of important bills that collectively will help to address this issue, including getting to my advocacy for those ignored, left out, and left behind, Justice for Incarcerated Moms. That's my bill, the Justice for Incarcerated Moms Act. 80% of incarcerated women are mothers, and 5% of incarcerated women arrive to prison pregnant. And these women are most often at risk for maternal health complications. They're denied critical bonding time with their newborns. They face physical and mental health complications that are exacerbated by inadequate health care. The Justice for Incarcerated Moms Act would help change that by creating systems to protect the health and dignity of incarcerated women and enlist them as partners in the fight for justice and equity. And so I'm deeply grateful to Representatives Underwood and Adams for their leadership and their sisterhood, and all of our colleagues from many walks of life and many types of districts, which is again a testament to your leadership, Representative Underwood. The most important person in the room is the one that can get everyone in the same Zoom room. And you have done that today. And so I look forward to continuing to partner with all of you to end the maternal mortality crisis once and for all. It is doable. And it is doable and completely within our reach.
Well, thank you for your leadership. This is one we were spending a lot of time talking about it. Like, how can we get this done? Because the sense of urgency, particularly for this population, is so prominent in my mind, in the front of my mind. And what can we be doing? What more can we be doing? And we just need to get it signed into law. Thank you for your incredible leadership. Thank you for joining us tonight. I'd like to thank Congresswoman Moore, who is still with us, who's been with us for the whole program. Thank you for your leadership. And thank you to everyone, all of our great stakeholders and partners around the country. We can't do this work without you. You all are who give us energy, you give us the ideas, and we take our cues from you. Thank you. We celebrate you. Even though we can't see you and we can't see each other, I feel the energy across the country. I feel the momentum, and I know that working together, we will be able to get the Momnibus signed into law. We will be able to save lives, and we will be able to celebrate and embrace these families who have been impacted by the tragedy that is a maternal death. Thank you all. Stay safe, stay healthy, and I'll see you next time.
Thank you, everyone.